So I find this routine very, very helpful, let's say for people who have arthritis or when the knee is very inflamed and it's painful to walk on, it's painful to move, it's still too painful to do any kind of progression or regression of the step-ups or any kind of movements which load the knee kind of through the quad, stepping down, stepping up the stairs. So we're going to just go over a few simple mobilization, few simple like first steps or set of the exercises. The first one is going to be just resting your knee or your leg nice and straight. You're just going to touch basically your kneecap, and then you will just gently try to move it a little bit side to side. Imagine like it should be moving into the four corners, so it should be moving down and inside, a little bit out and down, up and outside, up and inside, almost like making those a little bit of almost like it is a circle, but you're trying to make it almost like a square, just like this, and just explore a few different directions. You might find, let's say, that upwards is moving fine, like for me, and inwards, but let's say outside into this corner is very difficult to push. You don't want to force anything, you're just trying to gently move it that way and maybe explore those movements which the kneecap is not willing or able to go to. After a few repetitions, even for me, like what I'm finding is I'm able to move there a little bit easier, a little bit just like this. So just nice repetition. You're not trying to force anything, just almost like let it melt. The next step is going to be just exploring a little bit of what is called like tibial rotation. So what you're going to do is just bring the feet or the ankle up just like this, and just bringing that ankle in and out. What you should feel is not just the ankle movement, but this bone over here should be rotating, just as you can see over here. And that's basically what we are after. If this motion is a little bit limited, and usually, let's say with the knee pain, very often there is nice movement outside, but when we are trying to move inside, there is very little movement. What we can do is just almost like provide a little bit of very gentle overpressure. So you're not trying to force it that way, but you're just trying to move it gently in, just like this. And again, just repeating for maybe like few repetitions. If you can imagine like this is the knee, and inside this cartilage, if it's sore, there is usually some inflammation, let's say some fluid inside. What you're trying to do is just introduce the little bit of gentle rotation in and out, almost like you're trying to pump that fluid and that inflammation a little bit out to the system so your body can filter it out. So again, this should be definitely pain-free. If it is a little bit tender, let's say on one side, then again just shorten it and then just gradually progress into it. Next step, let's say if this rotation is now, if your knee is rotating actually quite nicely, what you can start to do is you can start to bend and straighten the knee, so just going up and down, just like this. And then what we can do is start introducing that little bit of rotation, so you just turn the ankle in, bring the foot, bring it out, straighten the foot, straighten the knee in. And again, my knee is actually pain-free, so some of these corners, and then you can just reverse the direction. It might cause a little bit of discomfort, so definitely do not push to the pain. So you can just go pretty much, you can just move it, you can slide basically the foot on the mat and just do the little bit of rotation just in and out. You can then practice this definitely in the standing position, where you just pretty much just bring the ankle, let's say outside, bring the knee in, out, in. The next step for a little bit of extra mobilization would be just bringing that ankle kind of up and in, and then just bending the knee and just providing that little bit of overpressure. Providing there is absolutely no pain, this is going to just help create a little bit of circulation into the knee.